Hey, how's it going? This is Dr. LeBauer, and today I'm going to talk about alternatives to surgery, especially during a time of crisis and COVID, especially when these surgical procedures and elective surgeries are being put on hold because our hospitals are becoming full. And I'm going to teach you exactly what to do about it so you can find the root cause of the problem and fix what's going on with your body so you don't even need surgery. You might not even need an MRI or medications. In the United States, in our society, everyone wants a quick fix, and they think when something hurts, that there's something wrong that needs to be fixed, and someone else has to fix it for them. And generally, if something hurts, you feel a pop, a crick, a crack, a sharp pain, and you go to see the orthopedic surgeon, and their tools are medications, injections, and surgery. I never tell you about people like me because they don't really understand what I do. Because most people think physical therapy is post-surgical rehab, but with the type of therapy and people I help active people stay fit, healthy, mobile, and strong without pain meds, injections, or surgery. And we've been doing this, like I said, for over 20 years. And at our clinic, we basically specialize in helping people understand exactly what's wrong and fixing the root cause of the problem. You just have to be willing to look for it and work for it. So let me explain a few things about how pain and surgeries work. So right here, you have pain, maybe in your knee or back, but generally you have three options. People say three options. It's, let's do an MRI to know exactly what's going on. So let me tell you why an MRI to know exactly what's going on isn't really the best option, because it doesn't tell you exactly what's going on. It tells you everything that's going on. It tells you everything that's going on in your body. MRIs and even x-rays are very sensitive. That means they pick up everything. And the radiologist in Ohio or Iowa or Montana or even across town who's never seen you in person, their job is to just read everything that they see and report. The biggest problem with MRIs right now is that your results come through like my chart and not through the provider who actually examined you to help you interpret them. And so you see all these big words and it's scary, and you go to Dr. Google, you look it up, and it makes it even scarier. If you've ever searched for your pain or problem on Google, have you ever looked for, am I sick? Do I feel sick? Are these the symptoms of COVID? Are these the symptoms of back pain? Are these the, what's happening to like my child when they're sick? Like, have you gone to Google? So basically, when you go to Dr. Google to search symptoms, Dr. Google scares you because Dr. Google is not really a doctor. Dr. Google can't interpret what's going on. So an MRI has a couple problems. It's great if we're concerned about cancer, like do you have a tumor? Do you have a fracture? Do we have a spinal cord compression, like especially for back pain? If I suspect those things, then we'll refer you to someone to get imaging. But if I'm just looking for the cause of why is your back hurt, or hey, you were deadlifting the other day and something hurt, an MRI is not going to tell me anything. It's just going to tell me a bunch of things that are going to scare you. The other option people have is, I got back pain. Let's take some medications. Well, we all know meds aren't going to solve the problem. They're just pain relievers. They're just going to put a Band-Aid on the problem. Now, sometimes, they work and sometimes they're great. But let's say, maybe you sprain an ankle and you take some Advil. Okay, great. It feels better. You can move it. You can walk on it a little bit more. But it's not something you should be taking on a daily basis. And really what happens is people go to the healthcare provider, physician, surgeon, and they're put on opioids. Even you get out of a surgery and right now, these days, you're given 2 weeks of opioids. 2 weeks of opioids, that's completely unnecessary, especially after this whole opioid crisis. If you're given opioids after a surgery, it should be for maybe 2 to 3 days. And then if you're still in pain and it's still intolerable, you've tried everything else, we'll give you some more. Have you ever been able to contact your provider and email them? Have you ever been able to call them and get them on the phone? No, generally you call someone, you sit in the waiting room for 30 minutes, maybe an hour, and then you see your provider for 10, 15 minutes. And that's not the way it works at our clinic. You can call and get in touch with one of our doctors. When you come and see us, we're with you one-on-one for up to an hour. But it's not all about like how long we spend with you. It's actually that we spend time with you and we talk to you. Our medication is exercise. And the other one is surgery. The problem with surgery is, number one right now, COVID. Okay? We need all the room we can in the hospital to treat COVID patients. And so elective surgeries like knee replacement, back surgery, hip replacement, cosmetic surgeries, they're all being put on hold. Do you really want to go in the hospital right now and risk getting COVID, hospital-borne infection, which has always been there, bleeding out, having something numb, dying, or even no change? Like, do you want to risk that before you've tried everything else that's safer? You could get physical therapy and you can get like massage. We've worked with a lot of people. I am a massage therapist myself who've been and got massage, and it helps. But after you get the massage, after you feel better, what are you doing to continue improving? It only helps for a certain bit, because all it mainly does is, it does a lot. It releases endorphins and addresses the pain response, and it makes you feel good. Okay, great. But then after that, are you working on correcting yourself? Are you working on home self-treatment strategies, etc.? Doing nothing? According to research, sometimes doing nothing is just as good as anything else, because a lot of the pain that we're experiencing is a response to threat, but it's not always a response to something wrong on the inside. So let me go back over to the MRI. Okay, MRI is going to show you everything on the inside, but what's on the inside, what's wrong, the root cause of the problem is not always what you see on the MRI. There have been numerous studies done. So 100 people without any pain, no symptoms. They walk by you on the sidewalk. We give them all an MRI. Over 50% will have some kind of finding in their spine on an MRI that if they had pain, someone would have recommended surgery. But remember, a majority of them have a finding, arthritis, degeneration, disc disease, etc., but no pain. Because likely when you have pain, you get an MRI and you see it, that stuff's already been there, because those are normal age-related changes. It's like wrinkles on the inside. So why is the MRI not so great? Because it shows you wrinkles on the inside. So what do you need instead? You need a total body diagnostic. This is a full body movement diagnostic exam that we do in our clinic, which looks at you from head to toe, looks at your whole body to help you understand the root cause. So what we do is we find out like where the problem is. Like, so we start with pain, and then we find out for the cause, and we make you stronger. So with meds, what's the problem with medications? Well, they're addictive. We don't want that. Okay. So what is it instead that we need to do? We need corrective exercise. We need self-treatment. So like you and a roller or a Theracane guided by us. And you also need to know how to progress your activities, because you can't just jump right back in and climb the Himalayas when haven't even gotten to base camp. The main thing I want you to understand is that when you have pain, generally you have three options: get an MRI, take some meds, even over the counter, or go get surgery. But actually, none of those are the best option. What you should do when you have pain is do these things. Don't worry. Okay, there's too many other things you should be worried about right now. Don't worry about your back hurting, because it's not the worst I've ever seen. If you've ever been told that by a healthcare provider, it's not that they're lying, is that they're just trying to make you feel better, but actually it makes it worse. Like, we've helped people who have so much arthritis that they shouldn't be running, which is what they've been told, get back to run and do triathlons, marathons, and Ironman. I've helped people who are told never lift more than 35 pounds ever again, deadlift their body weight. We've worked with people who've been told that chaturanga, which is a yoga pose, is the shoulder shredder. Continue to do yoga and lift weights overhead and pick up their kids or reach in the cabinet overhead. So don't worry when you have pain. The next thing you need to do is keep moving. A lot of times things are worse in the morning and better in the afternoon. That means you're just stiff. Muscles might be tight. Sometimes even if you do have arthritis, it's not a death sentence. You just need to move the joint. And as the joint gets lubricated and your body gets triggered to send more fluid into the joint, it feels better. Generally, a lot of pain is triggered by muscle tightness, trying to stabilize you in one place when there's a problem somewhere else. So don't worry, keep moving. And the other one is get a total body diagnostic. If you've ever had pain or an injury and people haven't looked at other places of your body, they're doing you a disservice. They're not actually looking for the root cause of the problem. they're just looking for something to blame. So for instance, people who have knee pain, a lot of times knee pain is said, oh, you have arthritis, we just need to clean it out and it'll be fine. But they never looked at your ankle to see, can your ankle bend the way it's supposed to bend? Or they never looked at your hip to see, is your hip keeping you stable? In my 21 years of experience, pretty much every time someone has knee pain, unless they had a direct traumatic event to their knee, like generally it's a big toe, an ankle, or a hip problem. There's just the muscles around your knee that are signaling you that something's not moving right. Back pain is generally a hip problem or a lack of variable posture. It's not a posture problem, it's a lack of movement, lack of exercise. 85% of Americans are going to have back pain at some point in their life. Don't worry about it. But what do you need to know is not just where the problem is, but you need to know where the root cause is and how to fix it. And how you fix it takes time. I'm sorry to say, it just takes time. I wish I had a magic switch where I could press on your head for 10 seconds and make it all go away. Surgery is certainly not going to do that, because even if surgery takes it away, you've got to recover from the surgery. You've got to go into a hospital or outpatient setting and risk getting exposed to COVID, or even just hospital-borne infections, which have been problems all along. You deserve to do everything in your power to fix this problem without going to drastic measures, because I guarantee you, surgery is not a panacea. Hey, and there are times when you absolutely need it. So my recommendation and the blessing right now is that if elective surgeries are being put off, this is your opportunity to see what else is available out there to help you fix this problem once and for all. And if you'd like our help, if you'd like a second opinion, or you'd like to just see, can physical therapy help you out? Even our brand of physical therapy, which isn't what you've experienced if you've been to physical therapy before, I would like to invite you to join us in our office for a free total body diagnostic exam. And what this is an opportunity to sit down with one of our pain and injury specialists and doctors of physical therapy to discuss your unique problem, help you understand where you can go, like what's possible for you with your body, find out what you want to get back to, what activities you'd like to be doing, even if someone's told you never do them again or that they're dangerous. And for us to build a plan together to get you back to feeling fit, healthy, strong, and active, so you can be, at least not let your body stress you out. And you can be an active participant in your life, the life of your kids and family and those around you. And we'll build a plan, a unique, specialized plan for you. And then if we feel like a good fit and we can help you, we'll tell you how we can work together. If this is something that we see, like you probably do need an MRI or X-ray, like we'll get you that. We'll help you get there or find the right person to help you. All you got to do is go to free TBD, like that's TBD, like total body diagnostic. It's, let's see, free tbd.com, and fill out the form with a little bit more information, and we'll get back to you within like 1 to 2 business days. So that's my promise, is 24 hours or 1 or 2 business days to get back to you, to actually talk to you. So you can talk to us, you can talk to our doctors, you can tell us what's wrong, and we will be there to help you out. Thank you very much. I'd love to know what was most helpful for you about this. Just post a comment below, and don't forget to like us, subscribe, and hit the notification bell, and look out for more videos from us coming soon. Thanks so much.